Welcome back to the Lost Book of Herbal Remedies. I'm Emma, and today we're diving into a major shift in how we protect ourselves against the flu. We'll be talking about a groundbreaking development, FluMist, a new intranasal flu vaccine approved by the FDA that can be self-administered or given by a caregiver. But it doesn't stop there. We'll also explore innovative vaccine technologies, the barriers adults face when getting vaccinated, and what the future holds for flu vaccines.
Yes, Emma, this really is a turning point. Think about it. Vaccinations used to mean scheduling a doctor's appointment or visiting a clinic, but now, with FluMist, you can literally give yourself the flu vaccine at home. A simple nasal spray for anyone aged 2 to 49, which means families can take control of their health. No more waiting in line or dealing with needles.
That's what makes this FDA approval so exciting. It's not just about making vaccinations more convenient. It's a step toward empowering people to protect themselves from seasonal flu, which, as we know, is still a major public health challenge. The flu isn't just a common cold. It's a contagious respiratory illness that leads to hospitalizations and even deaths every year.
Exactly. The introduction of FluMist reflects a larger trend in healthcare, making preventive measures more accessible. But this is about more than just convenience. It's a leap toward innovative healthcare solutions. FluMist represents a broader commitment to embracing new technologies in vaccination. And when we think about the bigger picture, self-administered vaccines like this could be a game changer for public health.
Absolutely. This is a pivotal moment because we're not just talking about the flu anymore. The pandemic brought COVID-19 into the mix, and now we're looking at the potential of combination vaccines. Can you imagine getting protection against both the flu and COVID-19 in one shot? Or should I say, one nasal spray?
That's where things are headed, and I'm so glad you brought that up, Emma. There's already exciting work being done in this area. The development of a vaccine called AIDC68 TAPE-BD, which targets both COVID-19 and the flu, is showing a lot of promise. It's an intranasal combination vaccine, meaning it works where these viruses enter, through the nose. By stimulating mucosal immunity, it can actually prevent infections and transmission right at the source, providing a much-needed frontline defense.
And the key word here is mucosal immunity. This is a critical concept because most respiratory viruses enter our bodies through the mucous membranes in our nose and mouth. A nasal spray vaccine like FluMist or the combination vaccine you mentioned activates the immune response right at the point of entry, which can be more effective than the systemic immunity provided by traditional vaccines.
What's great about these combination vaccines is their versatility. They can be used as both a primary immunization or as a booster for those who've already been vaccinated. That's incredibly important when we're dealing with the complexities of managing co-circulating viruses like the flu and COVID-19, right?
Definitely. And this also speaks to the larger issue of vaccine uptake, particularly among adults. Despite the well-documented benefits of influenza vaccination, we're still struggling to get enough people vaccinated, especially older adults. Research has shown that there are multiple barriers to vaccination, everything from socioeconomic factors to health-related issues like comorbidities.
There's also a huge psychological component. Self-efficacy, or an individual's confidence in vaccines, plays a big role. If someone doesn't believe the vaccine will work or doesn't trust the healthcare system, they're less likely to get vaccinated. That's where healthcare providers come in. Their recommendations are powerful motivators for people to get vaccinated, but they need the right training and resources to engage effectively with patients.
Exactly, Alex. And that's why education and awareness campaigns are crucial. If we can address some of the common concerns and misconceptions about vaccines, like fears about side effects or the idea that a healthy person doesn't need a flu shot, we can empower people to make more informed decisions about their health.
And let's be honest, there's still a lot of misinformation out there. But the good news is, tools like FluMist are designed to make the process easier and more approachable. When you combine accessibility with proper education, it can make a real difference in vaccination rates. Let's also not forget that the need for these innovations isn't going away anytime soon. Seasonal influenza will always be a concern, and now we have COVID-19 in the mix.
Which brings us to the pursuit of a universal flu vaccine. Now, this is one of the most exciting developments in vaccine research. Current flu vaccines have to be updated every year to match the most common circulating strains. But what if we had a vaccine that protected against all strains?
That's the goal, right? Scientists are working on targeting the more stable parts of the virus, like the hemagglutinin stalk, to create a universal vaccine. A candidate called CALI-V is being developed that uses chimeric hemagglutinin to induce long-lasting immunity against a wide variety of influenza strains. Imagine the impact if we could get that level of protection. No more annual updates, no more guessing which strains will hit us hardest.
It would be groundbreaking. A universal vaccine could drastically reduce the global burden of influenza. We're talking about protection against both seasonal and pandemic strains of the virus, which could significantly reduce hospitalizations and deaths worldwide.
That's the kind of innovation we need, especially as viruses evolve. Speaking of evolving viruses, we also have to consider influenza B. This is a virus that often flies under the radar compared to influenza A, but it's responsible for up to 30% of flu-related deaths each year. And it mainly circulates among humans, affecting vulnerable populations like children and the elderly.
Influenza B doesn't get enough attention, but it's just as deadly. That's why we now have quadrivalent vaccines that include strains from both the B Yamagata and B Victoria lineages. These vaccines provide broader protection, which is crucial for reducing the impact of the virus.
And the genetic evolution of influenza B is something we need to keep an eye on. Both lineages undergo antigenic drift, but the Victoria lineage tends to evolve faster, which can make it harder to predict which strains will circulate each year. That's why continuous surveillance is key for effective vaccine composition.
And the same goes for managing infections once they happen. Thankfully, we've seen advancements in antiviral treatments. Neuraminidase inhibitors like oseltamivir have been effective, but there's also a new class of drugs like baloxavir marboxil, which targets the polymerase activity of influenza viruses.
Right. Baloxavir has shown promise because it works against both influenza A and B, and it's a single-dose treatment. That's huge for improving patient outcomes, especially for people at high risk of severe illness.
And as we look toward the future, there's even more exciting work being done in nanotechnology. For instance, peptide-functionalized selenium nanoparticles are being developed as a novel approach to enhance antiviral efficacy against both SARS-CoV-2 and the flu.
The potential here is incredible. These nanoparticles can target the viral envelope, essentially preventing the virus from entering human cells. Not only does this inhibit viral replication, but it also minimizes inflammation, which is especially important for people dealing with severe cases like those caused by COVID-19.
And let's not forget that selenium nanoparticles have shown efficacy against RSV as well. So while vaccines are our first line of defense, we also need to consider these innovative therapies to complement vaccination efforts. The combination of vaccines and cutting-edge therapies will be key in tackling respiratory viral infections moving forward.
Exactly. So to sum it all up, we're seeing a huge transformation in how we approach influenza vaccination, from self-administered vaccines like FluMist to combination vaccines that tackle multiple viruses, and even the pursuit of a universal flu vaccine.
And while these vaccines are a crucial part of the solution, it's also important to support our body's natural defenses. That's where herbal remedies come in. For centuries, herbal medicine has played a vital role in helping people manage their health, and today we have a number of powerful botanicals that can help fortify the immune system, especially during flu season.
Exactly, Emma. Herbal remedies can complement conventional approaches like vaccines by helping to reduce the duration and severity of symptoms, or even by acting as a preventive measure. Let's dive into a few herbs from the Lost Book of Herbal Remedies that have been shown to support the body's natural immune defenses.
First up is elderberry, or Sambucus nigra. This is one of the most well-known antiviral herbs out there. Studies have shown that elderberry can reduce the severity and duration of flu symptoms. It's available in various forms, including syrups and extracts. You can take 1 to 2 teaspoons daily during flu season, or as soon as you start feeling symptoms.
Elderberry is amazing. Another great herb is astragalus, which is known for enhancing the body's production of interferons. These are proteins that play a critical role in the immune response to viruses. Astragalus works best as a preventive measure, and you can take it in tincture form, 20 to 30 drops twice a day.
And we can't forget echinacea. This herb helps boost mucosal immunity, which is exactly what you need when trying to prevent respiratory infections. Echinacea can stimulate the production of immunoglobulin A, IgA, in the respiratory tract. It's perfect for early intervention. You can take 1 to 2 milliliters of tincture 3 times a day at the onset of symptoms.
Then there's andrographis. This herb is particularly effective at preventing viral attachment and entry into the cells. It's been used traditionally in many cultures to treat respiratory infections. During flu season, you can take 400 milligrams of standardized andrographis extract daily for up to 5 days if symptoms start to appear.
And one of my personal favorites is licorice root. Licorice contains glycyrrhizin, which has been shown to inhibit the replication of influenza viruses. You can take it as a tea or tincture, but make sure to keep the dose within safe limits. No more than 100 milligrams of glycyrrhizin a day to avoid potential side effects.
Green tea is another fantastic option. It's rich in catechins like EGCG, which have powerful antiviral properties. Drinking 3 to 4 cups of green tea daily can give you a boost of antioxidants and help your body fight off flu viruses.
Let's also mention reishi mushroom. It's known for modulating the immune system and providing antiviral support. You can take reishi as a powder or extract. About 1 to 1.5 grams a day is a good dose.
And last but not least, we have selenium. This trace mineral has immune-boosting and antiviral effects, which is why it's great to include in your flu prevention regimen. You can get selenium through foods like Brazil nuts or consider taking a supplement, but make sure you stay within the recommended dose, 55 to 200 micrograms daily, to avoid toxicity.
All of these herbs and nutrients work together to support the body's natural defenses against respiratory viruses. They can help you stay healthier throughout flu season and reduce the impact of the virus if you do get sick. But remember, it's important to consult with a healthcare provider before starting any new supplement, especially if you're pregnant, breastfeeding, or have underlying health conditions.
That's great advice, Emma. Supporting your body's natural detox pathways and immune system is just as important as vaccines when it comes to staying healthy. So, whether you're using these herbs as preventive measures or to boost your recovery, they're a powerful addition to any flu-fighting strategy.
And the best part is, these innovations are designed to empower individuals and families. Vaccines are becoming more accessible, more convenient, and more effective. It's an exciting time for preventative healthcare.
If you want to dive deeper into any of these topics, check out our full article on herbalbloom.org. We cover everything you need to know about the latest advancements in flu vaccination. Thanks for tuning in to the Lost Book of Herbal Remedies. Stay informed, stay healthy, and take care.
Thanks, everyone. See you next time.